All right, let's talk about a pill that really, truly changed the game in the fight against breast cancer. This is the story of how we learned to outsmart a disease, beating it at its own biological game.
So here's the central puzzle, the thing that makes tamoxifen so fascinating. Get this. How can one single drug fight cancer in one part of your body, but act like a friend, even a helper, in another? It sounds kind of impossible, right? Well, to figure that out, we've got to start with the cancer itself. Okay, first things first. To get the solution, you have to get the problem. And for a whole lot of breast cancers, the problem is actually pretty simple. It all comes down to a renegade switch, a tiny biological signal that's just stuck in the on position.
So that renegade switch, it's the hallmark of what we call estrogen receptor-positive breast cancer. You'll hear it called ER-positive for short. Now, this is the most common type, and the name really tells you everything you need to know. These cancer cells, they have these special little docking stations, or receptors, that are just waiting for the body's own estrogen. And when estrogen locks in, whoosh, it's like pouring gasoline on a fire. And the way this works is surprisingly simple. I want you to think of it like a classic lock and key. Estrogen is the key. The receptor on the cancer cell, that's the lock. And when that key slides in and turns, it sends one single, incredibly dangerous command: grow and make more of yourself. That's it. So if the whole problem is a key turning a lock that tells the cancer to grow, well, the solution, at least in concept, is pretty elegant, right? You just need a decoy key, something that can get into that lock first and jam it up.
And that right there is tamoxifen's mission, plain and simple. It's designed to literally race against the body's natural estrogen. It rushes in, gets to those receptors on the cancer cells first, and just parks itself there. It's like putting up a giant no vacancy sign.
Okay, so here's the absolute critical difference. Estrogen, the right key, fits in the lock and turns that growth switch on. Tamoxifen, our decoy key, it fits into the very same lock, but it's a dud. It can't turn the switch. It just sits there, physically blocking the real key from ever getting in. And the result? The cancer cell is literally starved of its fuel. It can't grow and it can't multiply.
But, and this is where the story gets really, really clever, tamoxifen isn't just a simple blocker. Oh no, it's way more sophisticated than that. It's more like a double agent. It has a completely different personality depending on where it is in the body.
This dual nature, this double agent behavior, has a fancy scientific name. It's called a selective estrogen receptor modulator, or for short, a SERM. And the most important word in that whole phrase is selective. This thing isn't a sledgehammer. It's a highly specialized tool that actually changes its behavior. It modulates it based on its surroundings.
Okay, check this out. It's incredible. In breast tissue where the cancer is, tamoxifen acts like an enemy, an antagonist. It blocks estrogen and starves the cancer. But then, in other places, it completely flips the script. In your bones, it acts like a friend, an agonist. It actually mimics estrogen, which is a good thing for keeping bones strong. But it also acts like a friend in the uterus, where it stimulates the lining. And this double-agent behavior is where we get both its incredible power and its biggest risks. So, with this really unique profile, how did doctors actually use it? Let's get into the mission debrief.
Basically, it has 4 key missions. The most common one is what's called adjuvant therapy. That just means you take it after surgery to stop the cancer from ever coming back. But you can also use it before surgery to shrink a big tumor or to control cancer that's already spread. And this is really cool, you can use it to prevent cancer from even starting.
Yeah, that preventative strategy has a name: chemoprevention. And it's huge. For people who are at a really high risk, maybe because of family history or their genetics, taking tamoxifen is like putting up this powerful biochemical shield. It actively cuts down the chances that they'll ever develop breast cancer at all.
And just how powerful is that shield? We're talking about a risk reduction of around 50%. Let that sink in. 50. That is a staggering number, and it just goes to show you how powerful this whole targeted approach really is.
But of course, there's no such thing as a perfect drug, right? Every mission has a cost, and it is so important to understand the risks and the side effects that come along with all these benefits.
A lot of the common side effects make sense when you think about what the drug is doing. Since it's blocking estrogen, it can feel a lot like menopause. We're talking hot flashes, night sweats, fatigue, mood swings, things like that. Now, for a lot of people, these are totally manageable, but they are a very real part of the deal.
And then you have the more serious risks. They're much less common, but you need to know about them. Remember how tamoxifen acts like estrogen in the uterus? Well, that's the double-edged sword. That action can increase the risk of uterine cancer. It also carries a small but real increased risk of blood clots, stroke, and even cataracts. That's the trade-off.
So, this is the crucial point. If there's one thing you take away about the risks, let it be this. Because of that risk to the uterus, any unusual vaginal bleeding while you're on tamoxifen is a major red flag. It's something you have to report to your doctor right away, no exceptions. It is the single most important warning sign to watch for.
So, when you put it all on the scale, the incredible benefits on one side and the very real risks on the other, what's the final verdict? Well, its legacy is nothing short of revolutionary. You know, its journey started way back in 1962, and funny enough, they were first looking at it as a contraceptive. But by the 70s, it found its true calling. And here we are today, decades later, and it is still an absolutely essential, life-saving medicine for millions of people all over the world.
And that really brings us to its ultimate legacy. See, tamoxifen did way more than just treat breast cancer. It was one of the very first drugs to prove this profound idea that if we can truly understand the specific biology that's driving a cancer, we can design a smart, targeted therapy to shut it down. It was a total trailblazer. It literally paved the way for the entire era of modern personalized cancer treatments we have today.